Welcome, everyone. We are letting folks file in, and so we'll just go ahead and get started in just a couple seconds, but we are excited to have you. We'll have our guest speaker start in a few seconds. All right, good afternoon, everyone. My name is Lauren Jones. I use she, her pronouns. I'm excited to have you all here today. I work as the Director of Diversity, Equity, and Inclusion for the School of Public Health. And again, I want to welcome you all to our Justice and Public Health event, which is part of an ongoing commitment that we have to anti-racism and anti-oppression in the School of Public Health. Before we begin, I want to acknowledge that the lands that we work and that most of us are living on are the traditional and current lands of the Dakota people. Minnesota comes from the Dakota name for this region, Minnesota Makoche, which loosely translates to the land where the waters reflect the skies. It is important to acknowledge on whose land we live, learn, and work as we seek to improve and strengthen our relations with our tribal nations. We also acknowledge that these words are not enough, and so we are working to ensure that our institution provides support, resources, and programs that increase access to all aspects of higher ed for our American Indian students, staff, faculty, and community members. Again, thank you all for coming to this event. The speakers and the presentations in our Justice and Public Health series help to ground us in theory and practice, as well as complement the classroom learning that our students experience. We hope that today's discussion is part of a broader change happening in and outside of the School of Public Health. If you're interested in staying abreast of other Justice and Public Health events, please be sure to fill out our event evaluation and check out the chat box to receive some information, as well as notifications in your email about upcoming events. You can also visit our website at any time to get that same information. This event will be recorded and will be available to view on our website in a couple of days for about 180 days. Now I'm going to let our speaker take over. Dr. Simone Kolysh is coming to us from Maryland, and I will let them take it from here.
Hi, everyone. Thank you so much for being with us today. I'm very excited always to talk to students and folks in public health. As Lauren mentioned, I come to you from Maryland, and I was putting stuff into chat box that was only going to us. So now the book I'll be mentioning is linked in chat, as well as additional resources that we should all be looking at, Beyond Land Acknowledgements. And you could read my bio. I think Sarah will probably put it into chat, but I wanted to let you know that my backgrounds more generally are in biology, in public health, and in sociology. So that gives me an important cross-disciplinary perspective on how to talk about issues that we face daily. And as you know, the talk will be about gendered violence, but the way I always conceptualize it is that it's a public health issue, not an issue that each of us simply deals with, that we could analyze in ways or in academic ways, but it is really a matter of public health concern and public health implications as well. And I think it's important to figure out how to talk about some of these issues through that lens, so that people who dismiss these concerns take it a lot more seriously. I'm going to share my screen with you. You can interrupt in chat. I'll try to take a look at it. You could let Lauren know and she'll interrupt me. My pronouns are they, them. And let's go. I'm going to play a slideshow from start. Is everybody able to see? Lauren, let me know, thumbs up or anything.
Looks good, yeah.
Okay. Okay, great. So just to review, the title of the talk is Redefining Gendered Violence, Daily Interactions as Oppression. Welcome to the Justice and Public Health series, this specific lecture today. Hopefully several of my students, if not all of my students, are here. Ordinarily, I teach a class at this time at St. Mary's College of Maryland. The class is on women's gender and sexuality studies, which is why this is perfect. About 10 years back, I was in grad school and I was getting my PhD in sociology. I was learning women's studies. I was, engaged on social media. I came across this quote by the Afro Legalese. That's their handle on Twitter. And it really transformed my thinking as far as my feminism and therefore my research. So it reads, my feminism is not about equality, it's about equity and justice. It's about individual choice and agency, free from hegemonic systems. I don't want to be equal to men. Men are not the standard of humanity. I want to live on my own terms, free from violence. And the reason why this was so transformative is because in a few sentences, it allows us to move beyond very typical conversations around gender inequality, feminism, and things like equality, because it speaks specifically to equity and justice, which are very big terms for structural changes, right? But it doesn't negate that there's individual choice and people making agential decisions on a daily basis. But if you then disrupt that or uncouple that from hegemonic systems, then you could really talk about being free. Because even if you're making choices today, but they are under this grand scheme of the patriarchy, white supremacy, etc., you're making choices within a very constrained set of variables or systems of oppression. And the other thing that changed my viewpoint on how to talk about any of these issues is, to stop talking about equality to men, because, well, not only are there more than two genders, but also each of our individual freedoms should not be dependent on any other group of people or defined in terms of any other group of people, particularly if that group of people, like men, are considered the default. And then we have to compare, kind of by definition, everybody else to that group of people. And we see this in statistics, we see this in our, in the way we teach and learn SPSS and articles and whatever, it just has to stop. And we just have to examine groups for their own experiences. And then that final sentence that gives me this impetus, right, this drive to this day to do whatever work I choose to do, is that I want to live on my own terms, free from violence. And this is something that we should have on our walls when we wake up in the morning, because it means that regardless of what you choose to do and what drives you and compels you and makes you passionate about living, you should be able to do so. And that means the way you express yourself, the way you love others, the way you couple with people or come into community, the way you do work or activism, your hobbies, right? And all of that, regardless of what that looks like, should be obviously a life free from violence. This is extremely difficult to come to terms with, because when you realize it, when you really think about this sentence, many of us do not live a life free from violence and do not have the capacity to freely move around, navigate our environments, have some mobility, have the ability to make choices, to quit, programs or leave our relationships. Actually, a lot of our lives are full of instances where we learn that we are not free as much as we thought. And that requires some interrogation, right? So One of the things I was particularly concerned about in my life, in the lives of my students, when I was in New York City, where I went to graduate school, were these issues or instances of catcalling. And there are many ways to define that term, but basically it's when you get harassed by others in public spaces, and you get sexualized and objectified, and various things are said to you or done to you. Okay, and this was taking place constantly, right? It's just a ubiquitous part of some of our lives. And it doesn't just happen in cities. It's just that cities are a particularly dense area where that's very likely to happen, but it certainly happens every place, and every place you go in the world. And then because I was coming into my lesbian identity, my non-binary identity, I was dating people, I was showing up with people on the street, I was doing activism, I experienced a lot of LGBTQ directed aggression as well. And sometimes it was happening at the same time. Someone would say, hey, you have a nice ass, and harass me in that manner. And then I would retaliate, and they would say, you're a fat dyke, or some sort of other slur that had nothing to do with my gender necessarily, but then had to do with my sexuality or with my partner's race, who's a Black woman. So I started to think about catcalling and LGBTQ directed aggression as joined processes. Over time, I developed this kind of idea that there are manifestations of everyday violence. And I want to pause there, because when you talk about daily interactions or our daily experiences, the reason they get dismissed is because, well, on their own, they appear kind of small. And there are issues that appear kind of big in the world. And so we're always told to care more about those issues, like child brides, sexual violence, I don't know, acid being thrown on women's faces all over, right? And we can actually worry or be concerned about multiple issues at the same time, but also remember that things we experience in our daily life connect to all of those other manifestations of violence, and that it's very easy to dismiss something that takes place daily if you're not thinking about the way these experiences accumulate. And that's going to connect later to this public health lens and angle that I started to use. And in sociology, there are a couple of approaches you could take to understanding society. I'm sorry, my dog has decided to have some kind of moment. And one of the approaches is to study things at a very abstract level, or really macro institutions, government, the elite, media, religion. You can study things at the meso level, kind of the juncture of our lives and how we interact with institutions, or you could study things at the micro level, which really is about looking at how we engage with others and how our life is, just regularly. And then when you study how our life is just regularly, there's something about that life that can give you larger answers about society. Often these things are dismissed by others, like who allow our projects to go forward, as me search instead of research. And I want you to understand that there needs to be a very serious critique in public health, in science, in academia as a whole, about these kind of positivist projects that assume that we cannot study our own selves. Because if you really truly think about it, the greats, Karl Marx and Durkheim and Du Bois and all of the folks, who we uphold as kind of classical sociologists and others, studied people like themselves too, and studied the daily lives of people like themselves. And so I failed to see why someone like me, who is a lesbian, who's non-binary, who has other statuses in society, can't talk about my own experiences and experiences of others like me, and figure out the overlaps and the distinctions, but also to figure out how my experiences connect to structural examples of violence, as I said, that are widespread against women and LGBTQ people. And so initially I wanted to talk to the men who catcalled me and others, and I did a pilot mini project with that. And then I started talking about this process with people who are on the receiving end of these interactions. And then I also started noting down my own experiences and what it was like. And that's why the method includes interviews with initiators of everyday violence, interviews with 67 recipients of everyday violence, and an autoethnographic component that is weaved in throughout the book. And the book is now linked for you. It is called Everyday Violence: The Public Harassment of Women and LGBTQ People. I also want to be clear what I mean by women and LGBTQ people. Women for me include cisgender women, transgender women, non-binary women, anyone who identifies as a woman and lives that life, as well as LGBTQ people who may then be any and all gender, of course. And it's also not a finite acronym. You know, we have an LGBTQ plus for a reason, because it includes folks who are asexual, who are intersex, who are, you know, questioning and queer in so many ways. And so ultimately, instead of these being fringe populations, once you put them together, they're actually the majority. And that's another way you can kind of reply to folks that dismiss your work about something particular that you feel is important. And so I wanted to give you this theoretical framework at this point, because it's, you know, how I conceptualize this talk, right? And how I conceptualize the work, by saying, you know what, the way we generally define violence, if we ask the DOJ or the FBI or the police, is pretty limited. Not only do these institutions enact violence in society pretty regularly, but they also kind of fail to properly count what's taking place, properly explain violence, or provide solutions to violence. What do I mean by that? There is a way hate crimes are defined against the LGBTQ community and against women based on gender. But when these hate crimes actually take place, the police fail to label them as such, which makes their, you know, end of the year report or any other reports inherently flawed and don't give us a full picture of what violence is like. And so I kind of studied across disciplines of gender and sexuality, LGBTQ studies, intersectional studies, intersectional work, urban sociology, to start thinking, and this is not a new idea, to start thinking about violence as a continuum. So instead of a binary way of thinking like hate crime or not, to start saying like, this is on this end of the spectrum, and then this is on that end of the spectrum. And there are all of these experiences that we have in the middle, and they are all kind of pervasive. And so kind of ignore the methodological ruptures component. This is for folks, you know, more at the graduate level, if you feel like, talking about how to do work reflexively in a feminist way, how to do it in a queer way, how to do it as a trans person and use trans studies. There's cloaks versus trauma is really interesting, because as researchers, our trauma and the way we have to navigate the world, especially the academic world, in terms of saving face or covering or showing one thing to survive. And we're cloaking all the time in order to navigate these very oppressive systems. And we're also dealing and healing our traumas. And some of that stuff shows up in our participants' lives, obviously, as they talk to us and as we take a look at what's going on. So there's a lot of reflection that you should be undertaking when researching any human phenomenon with any human beings involved, because once again, that obsession with objectivity, that obsession with neutrality is not very good science, because it belies the fact that these things come out in the field and in the research process. And so I just wanted to, you could read this whole thing, you don't have to. I just wanted to say that intersectionality as a lens was essential from the beginning. And so I want to just quickly define what that is, coming out of Black feminist thought, coming out of Kimberly Crenshaw's lifelong work. Intersectionality as a lens, it's an academic and legal theory kind of that informs us that our position in the world is determined by the intersection of our race, class, and gender. And that intersection determines our access to power and our experiences with oppression, but fundamentally that it was intended to interrogate the lives of Black women who faced classism, racism, sexism. And Kimberly Crenshaw established this term called intersectionality, but lots of folks before and after have talked about the multiplicity of not only their identities, but their experiences with inequality. And I consider myself a pretty classical scholar of intersectionality, and I see it misused all the time in public health and in other fields where people call themselves intersectional feminists or intersectional anything, and it's actually just a framework. And if you're not using this as a framework to interrogate the lives of Black people, people of color, and if you're not centering race at the middle of your analysis, then you're not doing truly intersectional work. Now, I want to be clear that you could study intersections in general, like disability and religion, sexuality and immigration status. And you could say that you're studying those intersections, but studying disability and sexuality without talking about racism or without centering Black people is not doing intersectional work. So I want to make that intervention clear, because I see entire textbooks that neither credit Kimberly Crenshaw nor understand intersectionality properly and continue to be published. And so keeping intersectionality in mind meant immediately that even if I'm speaking about something that has to do with gendered violence, or if I'm speaking about something that has to do around sexuality, race is going to be the entry point, the kind of thing that mediates it almost immediately. And just, it's impossible to separate out, right? But I also wanted to use techniques within feminist sociology. Now, again, there's not a lot of that being taught. And in my classes on ethnography, in my classes on qualitative research, there weren't even women on the syllabus, or they were in very tokenizing ways. But I had to get an entire certificate in women's gender and sexuality studies to find women and folks who are not men, who are non-binary, who are trans, or using other identities, that talked about their experiences with conducting research. And the reason it's important to use feminist approaches is because it works better with that messiness I mentioned before, where the person who conducts research is aware of their positionality in society, is aware of the power dynamics and power and the difference in power between you and the subjects that you're talking to. Often in public health, I remember being in positions of power, not just as a white person, but just as a representative of the Department of Public Health or whatever, just these institutions that would go into these underserved, quote unquote, neighborhoods that they would deem as disadvantaged. And just our entire approach to solving whatever it is we thought we were solving was incredibly oppressive and deeply problematic. And I remember there were many different pamphlets, briefs, reports done about these neighborhoods, the children there, or the women there, or the people there, that didn't take into consideration the fact that oppression faced by these people was designed by people in power, that neighborhoods aren't about people who live in them, but they are about food deserts, segregation, gentrification. And being an urban sociologist really helped there, because I could find some scholars in urban sociology who, didn't just talk about people, as a criminal element, or as an element of poverty, or as an unchanging part of the urban landscape. But there were some folks in urban sociology and environmental studies talking about, what conditions people are born into that determine whether they're going to have a healthy start in life, or access to food, or exercise, or information. And I just realized that often the way we do public health is accusatory and doesn't take into consideration the social and behavioral determinants of health and illness. Now, I certainly took social and behavioral determinants of health and illness as a class, and I'm going to be teaching it next semester for the first time for me at the college where I teach, but it should be required. And it should be the way we lead in public health, instead of the rhetoric we use now, which places so many of the burdens on the individual. And I know that in comparison to medicine, public health does quite a little bit better on that, but there's still a ways to go. And feminist public health that keeps intersectionality in mind and actually uses it appropriately, and relies on all these other theoretical frameworks that help us push past neutrality, positivity, objectivity, all of that, is going to do better work. It's going to recognize, what takes place when something like a global pandemic is happening, and why people are disproportionately impacted by that. Okay, moving along. I just wanted to actually briefly give you a sense of my recipients. So I interviewed a lot less catcallers than I did recipients. And so of the 67 recipients, I just wanted to let you know that I also went about collecting their demographics differently. And this is where public health, medicine, quantitative science gets stuck, because they say things like, we didn't collect information about trans and non-binary people because the survey only says male, female. Well, the survey sucks, and you can change it. And we should change it, because there are not just male and female people, and they're not just men and women. And so as we have the power to rewrite the rules, we definitely have to, in order to account for more diversity in society. And one of the things I did to help me with that is ask people what their gender, sexuality, race, class, education, and age were. Excuse me. And that way I was able to, at least in this research project, get to people who are trans women and genderqueer and non-binary and gender fluid, gender nonconforming. One person saying they're a female to male transsexual person, which is kind of old language, but the person was of prior generation, and we could talk about language and how it shifts and how dynamic it is in Q&A. But anyway, it allowed me to see how people name themselves versus how institutions or the census or the forms we use name people. Now, quantitative researchers always provide a critique that this just then ends up with a very small n. And you could say this entire project also has a very small n, but having a very small n should not be a reason to dismiss a project that illustrates something. Now, I may have a small n because I was doing this as a graduate student without funding from the NSF, or without a team of people, or without some kind of federal effort. But if you were to now do the same project and ask the same questions, you'd find the same answers. And so a small n, nevertheless, is illustrative. It does not have to be generalizable, and it does not have to be replicable in order to say something of that matters, okay? And so when I then took a look, as I went through my research at the demographics, it was really important for me for it to be representative. Now, once again, it does not have to be replicable or generalizable, but it did need to represent New York City because that was the environment I was studying. And so sometimes people, I do a lot of talks on methodology and how to go about work and research and conducting it. Folks end up kind of stuck with samples that are all white, with samples that are all straight, with samples that are all like the default group of people. And they're doing work in New York City or in coastal areas or in very diverse places. And it's very shocking that it's not reflected in their sample because you weren't explicit about making a representative sample. So one other advice I can give you today, or just have you think about, is the excuses we constantly make about not getting to certain populations. And so it's not part of this presentation, but one of the ways that I collected my participants or like collected people to participate was to explicitly say, here's how this is an intersectional project. Here's what that actually means for me. I need explicitly people at this point who are Black, Latinx, Indigenous, whatever. I have too many white participants. I am not interested in any more white participants or any more straight women or any more whatever, and made that explicit because I was pausing at specific points in my collection to calibrate whether this chart right here looked like New York City compared to New York City. Now, obviously, when it comes to gender, I have a lot more information than anybody in New York or whatever. When it comes to race, there was some information, and it fits pretty much this way on my race, side of the table and whatever. Education, of course, ended up being overly skewed to like higher educated people, just because of how my snowballing works. And all of these things you need to explain either as reasons for why your sample looks like that or as limitations, okay? And this is also a very important part of our work. So now I'm going to watch the time. I have another half hour and deliver some of the findings from this work and, what's taken place conceptually since I finished my PhD and how maybe I've rethought some of these things. So I did conclude that catcalling and LGBTQ directed aggression are forms of everyday violence that shape people's gender and sexuality, and that they are co-constituted by race, class, and space in a violent way. So what does any of that mean? It means that when you are constantly harassed and across all spheres, like you could wake up in the morning and be dealing with forms of sexual violence at home, go outside and be sexually harassed by a catcaller or 7, enter an educational sphere like a K-12 environment and be sexually harassed and otherwise harassed there. Leave that environment and maybe go to work, say for college students or high school students, and be harassed at work. Leave work, it's dark now, and you're back to being harassed in the public sphere. And by that, I mean the streets, the subways, parking lots, beaches, places. Let's say you go out at night and you want to go to a bar or a club, you're going to be harassed there. And then after the club on your way home. When that happens, from unfortunately the average age of the first public harassment for my participants was 11. When that happens from the age of 11 through whatever age my participants were at the time of our interviews, there is there are many impacts that you internalize. And by the way, sexual violence doesn't just happen on average at the age of 11. That was generally the age people experienced public sphere sexual violence. Very unfortunately, I learned that people experience sexual violence at home at incredibly young ages, age 2, age 3, age 4, age 5. It was extremely commonplace to find that experiences of catcalling and LGBTQ directed aggression on the streets reminded people, triggered people's memories and experiences of those violations that took place at home and in school, and that those violations took place really early on, okay? And so that's in part why I require that people do more of a feminist analysis about what's coming up in an interview, because you actually need to be trained appropriately in handling people's trauma and be trauma informed in how you approach people. And interviews are so interesting because you're meeting a stranger, you have an hour to two to build rapport really quickly and be genuine in your interactions. And they're sharing some of the most intimate stories or intimate parts of their life with you. And they are those can be very heavy, and they can be overwhelming when you start, interviewing person after person after person after person. And you see that the things we carry as our private experiences that are full of shame and stigma are everybody's experience, that they are not individual issues alone. They are a public health concern. Childhood sexual assault is a public health concern. Catcalling is a public health concern. Sexual violence at schools and at work are a public health concern. These are not things that we should talk about as an individual issue, but these are things we need to address at every level of society. And so when you experience harassment over the course of your life, you internalize certain ideas about yourself, and we have lots of other data and studies that show this. You start to objectify yourself, actually, and you start to judge yourself. You start to think about how your body looks and how you should dress it and where you should go and what you should bring and what to tell your friends. And there's like this entire internal world that people are involved with that takes up so much energy just to keep you safe, during that one day where you may be at a club and at work and at school and at home. And that serves as a huge distraction, to us all. Racism is a distraction, sexism is a distraction, homophobia, and ableism, and all of the forms of oppression we talk about are impacting us not only just negatively, but they are keeping us from being free and doing things on our own terms. I always go back to that quote. But these things are kind of shaped by race, class, and space. And I chose race, class, and space because intersectionality requires that you interrogate race, class, and gender at the very least. And Kimberly Crenshaw has written since, to sort of extend an intersectional analysis to sexuality, to other forms of oppression and stuff. And so you as a scholar and as a researcher can choose. But once again, I remind you, race has to be part of that conversation. And so later when I show you the model that I developed out of this work, it's a modular. You can insert different forms of oppression to study an issue from a different perspective. But the fact remains that they are all connected. And that's why intersectionality as an approach is superior to others in most ways. So I will die on this hill. So we could talk about that in Q&A. And so it's not just that the people experiencing violence experience it in a racialized way. It's that the people enacting violence experience racism and classism as well. For example, when we have a conversation about who the catcallers are, and you just like ask random people, there are these pervasive racist and classist stereotypes that only Black and Latinx men do this, only construction workers do this, men who have this culture or that culture do this. And it creates, as I mentioned here, this like imaginary villain that society wants to blame when society is to blame. And this kind of villain has had a serviceability throughout the centuries. It's how Black men were lynched. It's the story of Emmett Till. It's the way people of other backgrounds and cultures have been demonized as more oppressive towards women. And these tropes are extremely harmful because they prevent you from actually studying the phenomenon of violence appropriately. Because if I was to believe these tropes and only go and look at the construction workers who are catcalling people, I would miss the fact that, yeah, maybe men who work outside conduct themselves in this way, but men who work at an office or are judges and bankers and whatever enact sexual violence on a daily basis and are entirely protected by those other judges and lawyers and bankers. And so it's about scale, and it's about precision, and it's about context. Obviously, if I'm studying public spaces, the men who hang, right, who hang around corners, who hang around parks, who hang as construction workers, as food service employees, right, truckers and the food truck people, whatever, right, they're outside. And because men are raised and condoned to sexually violate others, that's what they're going to do as part of their job. But I want to be very careful that all men do this as part of all jobs. It's just that when you then study different environments, that's kind of what you start to see. And in fact, you could blame Black and Latinx men all you want, or edit videos on YouTube, however, to construct this narrative. But the fact remains that men of all races engage in sexual violence against women and LGBTQ people. And there may be specific ways they do that that speak back to these stereotypes, but that's not good science to reproduce it, okay? So I started to also think about like this anatomy of violence, like how does it all work? Like if I were to tell you sort of the characteristics of these processes. And unfortunately, while cisgender and heterosexual men are not the only initiators, because women harass others, straight women can harass a gay person, cis people can harass trans people, etc. Nevertheless, they remain the primary initiators in my and other people's work. So similarly to, let's say, taking back the night events or events that talk about sexual violence, you could say that it's not an issue of men versus women, that people of all genders experience sexual violence. That's fair to say. But it's also really important to point out they experience sexual violence from men primarily, and that difference in size and intensity matters. Because yeah, women rape too, transgender people rape. There's intimate partner violence in queer communities, which we need to address, etc. But there is still nevertheless this very clear sense from all our work that men nevertheless are the primary initiators, but other people can be too. And that's because they have, what they're working with is not just that they are heterosexual, that they're cisgender, they have this toxic masculinity, you know, it's whiteness sometimes, but not all the time. It creates a very dangerous mix. You know, actually we can kind of connect this to school shootings, other forms of extreme violence, because the perpetrators are the same. To some extent. They do tend to be also primarily white when it comes to school shootings and not to catcalling, but that's because New York is so diverse. So let's just, aside from that, kind of talk about the impact these interactions have on people who are on the receiving end. And this is where I start thinking about a public health lens again. I start thinking about the short-term impacts and then kind of the long-term impacts on one's health. And by health, I really do mean a very broad term that includes one's emotional well-being, one's body, one's trauma, one's somatic responses, one's psyche and psychological, ways of coping. Not just these very standard indicators of health and illness, but just very broadly, the well-being of a person. And so I mentioned that some of these could be triggering. Unfortunately, the strategies people engage in to counteract some of these interactions are not at all successful. So the usual, I have a boyfriend, doesn't work. I am a lesbian, doesn't work. I would like you to stop, doesn't work. Nothing really works because it's both commonplace and condoned, even if people don't like it. For example, I went to my mother when I was 12 and I said, hey, I'm getting yelled at or people talking about my body. Why is that happening? My mother, who I would consider to be part of the majority in society, she's an immigrant Russian Armenian woman, who has forgotten her immigrant past, was just like, that's what men's eyes are for. And that's not very helpful because these stereotypes that we have developed about genders and their behaviors don't make you feel any better about how that's taking place. And no, that's not what men's eyes are for. Buying into that kind of rhetoric, buying into that men are hardwired for violent, sexualizing, objectifying behavior reproduces patriarchy. And we actually want to dismantle that, obviously. And we don't want to say that people, by the nature of their biological characteristics, behave in specific ways. All of that needs to actually be completely deconstructed and thrown out. The long-term effects of these, I keep thinking of the work around race and racism about weathering. You may have heard the term weathering. This is when the impacts of racism, erode a certain sense of self. They have this kind of drip approach to impacting people's health and well-being, resulting in chronic disease, in chronic stress, in all of these terms we use to kind of basically say it makes you sick. So like racism, experiences of sexual violence make you sick. Obviously, if you then experience both forms, sexism, racism, classism, ableism, whatever, then the impacts are larger. I don't really like talking about these things in an additive way, right? Because that's not how that works. But because these things do intersect, I think there are many ways in which you get injured as a result. So for example, a white woman can complain about being catcalled, and she has every right to do that. But a Black woman who is talking about her experiences can talk about how the catcalls that she hears are racist. Or an Asian woman in New York can say like, yeah, like he talked about my body, but he said, and I'm not going to insert a racist statement here, but he said it like this about me because I'm Chinese or I'm Latina. So he called me like spicy or whatever, right? Like it's not the same experience that someone like me who's perceived as a woman, even though I'm not, that's how I get harassed. I would never hear something like that. I could hear something about being a lesbian, maybe something about my appearance, being fat, being disabled sometimes, whatever. But I'm never going to hear what my Black partner hears on the street in the same way, in the same areas. And that specificity, that distinction, that difference really matters because you as a researcher and you as a public health professional have to attend to those differences. I know that the rest of the world is is deepening its fascism and ignoring and whitewashing and taking out the words gay and taking out CRT, which stands for critical race theory, and just in general closing up shop on women's studies departments and ethnic studies departments and whatever, in this effort to ignore difference. But for as long as I'm able to speak to it, that's the approach I think is much more effective and more important, because you want your work to apply to as many people as possible. Interventions in public health almost always fail to achieve what they want to achieve, because they don't take into consideration cultural, racial, ethnic, sexual, religious differences appropriately. There's all kinds of talk about cross-cultural this and cross-cultural that. You actually have to talk to people from the different groups you're working with, and they actually have to trust you. And health professionals, public health professionals, academics don't have a good track record for doing good in oppressed communities. They do have a good track record of researching those communities, but not actually impacting those communities in any way that matters. One of the some of the themes I want to tell you, themes of visibility and invisibility shaped by race and class, really inform how people make sense of their life, like whether they hide who they are, whether they dress one way, but they would want to dress a different way. I'm a 38-year-old adult, and when I was dancing tango in New York, which takes place later at night at tango parties, I would still make a backpack of my tango clothes and then dress up more like sort of just jeans and sneakers to go to the party, because if I were to wear my tango outfit, I would not make it from the house in Brooklyn to the area, the dance party in Manhattan. And I have whiteness on my side. I have whatever other privileges. And I still carried the backpack, got to the tango party, went into the bathroom, changed into my skirt and like shirt and heels. After the tango party, it's like 5 a.m, you're exhausted. I go back to the bathroom. I take off the heels, the skirt, the shirt, and I put back the jeans, the sweatshirt, and take off my makeup and take off the flowers out of my hair and just like cover myself in different ways to make it back home. And I think saying I'm 38 matters, because my students who are 17, 18, by and large, you know, are experiencing the same thing when they're going clubbing or doing things or whatever. And it's just like, I think it's very disheartening not to give them some kind of answer as to what to do. All we keep telling each other is how to be safe, but you are living in an unsafe world full of violence. And I can't tell you how often I talk to men about some of this, and they're walking the same streets, right? They're supposedly in the same reality, but their experience of it is completely different, because they're not thinking about any of that. They don't have that backpack, and they are not being harassed. It's interesting that a long time ago, Irving Goffman was talking about urban life, and he was talking about this thing called civil inattention, that the way people move in a city is civilly and without paying any attention to each other. And I was reading that text and I said, where? Who is experiencing civil inattention? Because I seem to be experiencing around a lot of uncivil attention that is unsolicited. And so, like every man who's written about everything ever, he only talked about himself. He was conducting research. I'll give him some credit because he did talk about the experiences of girl watching. This is kind of an earlier term prior to catcalling. He did talk about that cities have a lot of that going on. So this is obviously a process that has always been around. And so actually when you study like 19th century spaces where people would get harassed on the street, women used to have these extremely long pins that they would put into their skirts. Obviously, these are, again, white women who were just barely now allowed to walk the streets, and those experiences are different from like immigrant women, Black women, women of color, who have always already been a part of like the public sphere. But in any case, they had those long pins. And if somebody would try to harass them, touch them, grope them, etc., they would try to pin them with those long pins. And please understand that just like us using mace or weapons today or something, that can escalate the situation where you could die as a result. Actually, people die as a result of simply saying no. And I started cataloging all of those in New York, and it became an extremely depressing component of my work. And then when people are like, well, why don't men do the right thing? They could die too, because men do sometimes do the right thing, and they stand up for strangers, or they stand up for their women, or whatever it is the case. As soon as they breach that bro contract, they can be threatened and injured and killed, simply for protecting somebody or standing up for somebody. So that's how you know that this issue isn't to be dismissed, that there's a potential for escalation in every catcall, and that you cannot actually say no and feel safe to do that. And when we cannot say no and feel safe to do that in a private setting, in a public setting, in any setting, you do not live free and on your own terms, and your life is full of violence. And I think it's extremely difficult to come to terms with that for us all, to understand that no, regardless the rhetoric and the lip service we pay and the policies we create, it's very easy to tell that we are not respected and our bodies are not autonomous. And in fact, they're porous. Started thinking about porosity a lot, about how certain people's bodies are just up for public consumption, fat people's bodies, disabled people's bodies, pregnant people's bodies, etc. People touch others, in completely inappropriate ways and just call it goodwill. So we could talk about lesbianism or bisexuality or whatever it is if you want, because when it comes to sexuality, there's actually not a good way to express who you are, in all the nuanced ways, because people are like, are you gay or straight? That's it. Like, how do you even show you're bisexual or asexual or polysexual in public? And so there are a lot of assumptions being made about our sexuality that may or may not be correct. I had several participants who were straight cisgender women who would walk next to each other holding hands or holding each other's waist or whatever, and they'd get bottles thrown at their head for being fucking dykes or whatever. And they would say, I'm not even a lesbian. And I would say, it doesn't make a difference, because it's about how others perceive you. And this is true right now, post-COVID. There's a rise in hate crime attacks on specific ethnic groups and on specific racial groups. And sometimes the attacks are by people who confuse the people. They didn't even mean to attack a person of that culture, but they're making assumptions and stereotypes that are deadly. So that theme of visibility and what gets perceived about you is what determines how safe you are. Okay. I also, talked a lot in my book about toxicity. I constructed this term with my colleagues to just kind of talk about how cities are toxic, and they are made toxic by cisgender people because of the way cisgender people treat transgender people. And actually, a lot of transgender people don't even go outside because of the way cisgender people treat them. And that's not okay. And right now, we can have all kinds of conversations about how transgender children are treated in Texas by Governor Abbott, and all these policies and conversations about anxieties around gender. And whatever point is, transgender people face more violence for being transgender and non-binary than cisgender people do. And therefore, that's where our focus should be, not on what cisgender people feel, think, or want to do about anything. Basically, it's completely irrelevant what the oppressor feels about the oppression they enact. That's kind of how I think about it. I don't care at all about what cis people think. I care a lot about how trans people cannot go outside as a result of this toxicity. Okay. And I want to then finish, let me see my time, just kind of as I move into the last 5 minutes, talk about how I started to really think about Not just, hey, race, class, and gender intersect, and here's how, and like it connects to space and whatever. Started to really think about how it's part of these neighborhood level processes, right? Like police brutality, like gentrification, segregation, all of that stuff that urban sociologists study distinct from gender and sexuality. So you can have a class on urban sociology, cultures of poverty, broken windows theory, blah, 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 and they'll never mention women or gay people or trans people or disability or anything like that. It's as if the city is just built for men, but the city is just built for men. It is not built for women or mothers or disabled people or people of color or anything like that. Cities by design are an oppressive space, but cities on paper are said to be these democratic areas where everyone can go freely to and from. And my research says otherwise. And I think your life experiences say otherwise. So yeah, obviously I'm a prison abolitionist. You eventually get there, even if you're not there yet, and restorative justice. But I started to think about how difficult things like restorative justice can be, because that means you have to have a community that stays consistent, that perhaps raises its young up until adulthood, talks to the kids and everyone about how we should behave with one another and how we hold each other accountable. And I think it's really difficult to do that if communities are always disturbed by gentrification, by poverty, by being evicted, forced out, etc. If there isn't like a kind of rootedness, a rootedness that people can have where they can grow up, you know, several generations in one place, I don't think you can have that kind of restorative justice very easily. So it's good to talk about, but hard to practice. And so let me just show you how the model is modular, just so that if you want it, you could use it. You know, so I sort of talked about how violence takes place between this group of people called initiators, this group of people called recipients. And often, by the way, you see how the arrow is going back from recipients to initiators. Recipients retaliate in all sorts of ways to experiencing harassment, and those could also be oppressive. So like a white woman could be harassed by a Black man, and in response, she calls him the N-word. In that one interaction, 2 instances of oppression took place. Even if there's a chronological order to that, I think you cannot ignore the fact that the way she responds to it is racist or classist or homophobic or something. So that's why there are 2 arrows, one large, one small, but just kind of to say that it is an interactive process impacted by race, class, and space. But you see, you can input anything else you'd like there. You could put ability or disability, you could put immigration status, you could put religion, you could put all of these components, and then it has impacts on gender and sexuality, but you could flip those components out into the side pieces. So you could put gender and sexuality impact whatever violence you want to talk about, and then that shapes how race and class operate in society. So it's all interchangeable because it's all connected, and it's all nevertheless impacted by the levels like community, neighborhood, state, nation, stuff like that. So the model is applicable to whatever you want to study. Please use it if you find it useful. Doesn't matter. I just made a page as to how many different fields or conversations could be impacted by simply studying our daily lives. And I put it there. This is my contact information. I am always happy to speak with everybody about anything. So email me, go look at my website, follow me on Twitter. I want to be very clear that my Twitter account is not a professional account, and therefore you will hear me say and do things there that are not very academic in nature, and that's by design, and is also a very intentional critique of how professional we have to be 24/7, and that I refuse to do. Thank you so much. I will take questions and stop sharing. Nichelle, is it? You asked, what is the fact behind cisgender people being toxic towards trans community that feels counterproductive, and that the toxicity is coming more from the trans community? Can you clarify that comment, please, for me? I'm finding it hard to understand. And I will take any other questions in the meantime. Are you asking, Nichelle, for the evidence behind toxicity experienced by trans people? The evidence were the participants and their lives and their experiences, and lots of other studies that show this is the case. Can I talk about the bills happening in Texas and other states? Yes, I certainly can. I was actually just speaking to a set of social workers, social work students who are about to, finish up their field placements and go and graduate and become social workers at a time like this. And social workers, as well as other health professionals, have a code of ethics. And I've taken a look at the social work code of ethics and others, and there are very clear rules that state that we value confidentiality, we value all components of our clients, and that something like the situation in Texas goes against our code of ethics as health professionals and social workers and teachers and nurses and all of that. So let's just actually first state that these cisgender governors imply something that isn't true. Their implication there is that if we support our transgender and non-binary children, whether emotionally or because we bring them to a health professional or help them with puberty blockers and figure out whatever else, that we are engaging in child abuse and that our families should be reported to child protection services. And that's a lie, because it's not a form of child abuse when doing so actually prevents suicidality and the terrible mental health impacts trans kids suffer when they don't have a supportive environment. And so that's first. Second, it establishes this surveillance and police state where people out children and destroy families, but it doesn't actually solve child abuse, which is a problem that is commonplace and is part of what I discussed, like childhood sexual assault. Like, why don't you worry about that and actually solve that? And ordinarily that's enacted by cisgender heterosexual men across all spheres, but all of that is ignored instead of this panic that's false. It's created out of nothing, which these transgender kids and non-binary kids are not experiencing. So it's going to have an immediate negative impact on their health and well-being, on the health and well-being of the families, and it has no evidence for the bills. It's kind of like the conversation we have about bathrooms, and that cisgender people are uncomfortable with trans people in bathrooms, and that's why we shouldn't have all gender bathrooms and whatever, blah, blah, blah. None of that makes any sense because there's no evidence that trans and non-binary people have ever done anything to cis people in bathrooms, but we actually do have a lot of evidence stating the opposite, that cisgender people constantly harass transgender people, LGBTQ people, and others in bathrooms and pretty much everywhere. Okay, so any kind of policy, right, should be actually aimed at making them stop doing that instead of imagining things that aren't there. Let me go back to Nichelle. You said, how is it that we as public health workers can improve on this determinant that seems rooted in bias based on emotional treatment of certain class of people? Well, all of, like you say, all of this is rooted in bias. So it's not just like that people treat trans people this way because they are ignorant about trans people and what that means. It's true of racism, it's true of sexism. Like when people hold racist beliefs or beliefs about a certain culture or religion, that's rooted in ignorance and bias too. And so as public health workers, I'm always going back, well, as anybody, I'm always going back to, before you can actually address this for your clients, you have to get informed. So if it's not part of your public health training to actually have a deep and fleshed out conversation about trans communities, then you have to get that information somewhere. Often I talk to social work students, psychology students, seniors in their final year, and they have never even talked about suicidal ideation or trauma-informed care. So actually blowing that up from trans and LGBT people to just pretty much everyone, folks aren't trained in discussing very difficult issues that impact people's health, like addictions or self-harm behaviors or whatever. I'm not even sure what the education includes, but it's missing a lot of what actually makes life hard for people. So if you haven't received information about transgender people, what that means, non-binary people, what that means, gender, the sort of people being shuffled into maleness and femaleness, and then there are intersex people, and then people are shuffled into boys and girls, but there's trans kids, and then there's people who are not straight and all sorts of others. Like, if you're not having that be a discussion every time, every class, and what's different and what's the same to others, then your education has made you ill-equipped to provide public health. And this is especially clear in colleges where I work as a consultant in New York, because regardless of your personal, religious, political, cultural beliefs, you're about to be unleashed onto a city with great diversity. And if your education doesn't account for that, you're ill-equipped. You're not going to be a good social worker, guaranteed. You're not going to be a good K through 12 professional, teacher, nurse, none of it, because you're still going to talk about your patients and your clients in oppressive, problematic ways. And we've all heard nurses, teachers, doctors, and whatever reproduce these ideas about people, where I have to then go up and be like, you should never speak like that about people ever again. And your license should be revoked immediately. And here's why, so I think getting informed and getting educated, attending this talk, things like that is so crucial. You can definitely learn and educate yourself and educate others, so that they are more equipped to actually handle the complexities of this world. So the binary nature of federal forms and grants is an excellent question. This is, again, going back to what I said about quantitative research, the census, these kind of seemingly static ways of understanding the world. I mean, there's lots of books out there that I can recommend that kind of go at this. Even if, for example, this is an issue with colleges all the time, when students who are trans want to say they're trans or have their ID cards reflect this or whatever. If a college is public, they'll say things like, for federal reporting forms, we actually can't do this on this website because it has to be male or female or whatever. Well, it doesn't have to be. So you can make a page, and I've recommended this to colleges, that comes first. The page, because you're in charge of constructing your websites, and you got to then have an IT team that is trans competent. That's impossible pretty much everywhere. But in any case, you go to the IT team and you say, I would like the following statement before students take the survey. The statement should say, unfortunately, to this day, the federal government pretends that there are only two genders. And not only do they pretend there are only two genders, they also treat it as sex and collapse sex and gender, and maintain that you have to pick male or female for some reason. And we at this school or at this organization or at this corporation know that our employees, our students, our clients are not just the two genders. And therefore, after you fill out the next page, which asks you for this, which we understand is violent and invisibilizing and upsetting, please put in to the next page your actual gender identity, your actual sexuality, actual race, actual anything else you'd like us to know about you, so that we can provide an accurate representation of our clients, our students, and whatever, internally. This is not a perfect answer. It's just that you and I, Lauren, may not have the power to change the census today. We could advocate and we could talk about it and whatever, but we could at the very least acknowledge that this is archaic and also doesn't give us information about people we want to know. Like sometimes people are like, men in comparison to men, women X, Y, and Z, I don't know, live longer, whatever. And you're just like, okay, but there's more than men and women. So are we talking about, when you're asking the men and you're asking the women, are there trans people part of this or not a part of this? Like what's happening? Like it's Women's History Month in March today, and there's no Trans People's Month, you know? And so everyone's like, happy Women's History Month, Simone. And I'm like, I'm not a woman, I'm non-binary, but anyway, I don't have a month, whatever. People just kind of get collapsed under these two, and you have to constantly push back and say, to your students or to whomever, like, we understand these forms reproduce the notion that there's only two genders. We know that's not true. We want to actually gather information and data about all communities that we serve. So please, you know, fill it out and then also provide us with actual, you know, labels that you choose for yourselves and stuff. I think when it comes to grants, right, and like when it comes to all of this, it just feels like so impossible to change for some reason. It's so static, it's protocol, whatever. But you have to understand that people made it up and we can unmake it up. Like there are very small grassroots organizations and approaches to grants and even work and application for work that have changed their parameters. They have changed how they collect information. They just said, no, we're not going to use this. Like, we'll say we need this for federal reporting, fine, but like this is the way we collect and report and explain what our population is. And this is, therefore, we're going to say, now that we didn't use just the men and women part, we see that we have a substantial number of trans and non-binary students. Since we have a substantial number of trans and non-binary students, our policies have to reflect that, our bathrooms have to reflect that, or whatever, our education has to reflect that. I speak with a lot of nursing educators, nurse educators who train nurses and stuff, and they always kind of hire me in secret to just be like, you know, rewrite their mission statement or their journal of nursing mission statement or whatever, to just incorporate more people. And it shouldn't be done in secret. It should simply say, previously our mission statement omitted the fact that we have a lot of trans and non-binary students or people who publish or folks who apply for grants. And now we want to acknowledge that there are more than two genders and people applying. And so from this point forward, we are now called X, Y, and Z. Like, it just always feels impossible until you just type it up differently and that's it. And so the way I address it is I show up somewhere. I did this with a very big part of the Eastern Sociological Society. They had a committee on women. I think it was just called a Committee on Women. Don't get me started. And 6 years ago, I showed up as the newly elected president of that committee. And I had 15 e-board members under me who were all cis women. And they thought I was one too. And then there was a conversation about, like, you know, moving away from it being a committee on women to something else that includes people more than women. And they were just kind of engaged in this transphobic conversation while I was CC'd. And they were like, oh, do we want to be, you know, prey to this new woke conversation? Do we want to, you know, do this for PC points or whatever? And I was like, well, actually, hi, I'm your new president. I'm trans and I'm part of the community. And this is not for points or anything. It's just to actually catch up with the times. And so we are going to vote on changing the name of the committee to the Committee on Gender Equity and changing the mission statement in this following way. And the mission statement, wherever it said women, simply started to say, you know, women and trans people or like whatever was relevant. And then we all voted and changed. And then I said, you know, that's not enough. It's not enough to change the name of your organization and the mission statement. You have to actually implement some changes. So since we always do about 7 to 8 panels from this point on, every single year, we're going to have a Trans Lives and Identities panel, regardless of the subject matter of the conference. That's going to stay, and it's going to stay here for as long as I stay here. And then after I quit, it's going to stay regardless. And if you don't have any other trans or non-binary members joining to help with that panel, then you have a real problem. And so there were these actions and steps that we took to like meaningfully incorporate trans and non-binary people into the membership and then into the kind of panels we put on, and just kind of also I mentioned to the rest of my e-board, and this was not an easy transition by any means, that they also in doing their panels have to not only understand that those panels should be diverse in terms of race and disability and immigration status and like all these things, but they need to have trans and non-binary people on the panels, not only talking about trans issues, but literally any other issue that concerns people. And they were uncomfortable with that because it would require them to know what trans and non-binary even means and how to communicate with trans and non-binary members of our sociological association. And so this is where I always go back to, like, you got to get comfortable with just even saying words like Black, disabled, transgender, lesbian. You cannot, as an adult, in any position of power, be uncomfortable with some of these things, because you have leverage and like you're teaching people, you're training the next generation, you're writing in journals. Like, to the extent that you have any kind of power in this extremely violent world, then it's your duty and responsibility to educate yourself about these issues. Sorry, that was like quick. So yeah, do fill out the evaluation form. We love those. And then check out the next event. And you already see that it's going to be on policing and incarceration, and why it's not like automatic to connect that to public health when it absolutely should be. Like, the issues of policing, of mass incarceration, of gentrification are public health concerns, even if you don't get taught that they are. Similar to gender and sexuality.
Well, thank you, Simone. I really enjoyed listening to you speak and learning from you. This has been awesome. I already put the information for the next event in the chat, and so you all can access that. Simone, did you want to share your contact info one more time?
Oh, absolutely.
Just in case people want to get in touch with you on social media, this is the Twitter and the website. Thank you all again for attending. We continue to push and center justice in this work, including but not limited to race, gender, sexuality, color, etc. And so I'm excited to continue to be partners in this work. Please fill out the evaluation and have a great day.
Thank you, everybody. Thank you to my students if you attended.
Thank you all.
Thank you, Lauren. Bye.